Good afternoon, everyone. It is now the lunch hour, so we're going to go ahead and get rolling. Thank you so much for joining us today. We're going to be hearing from Miss Emma White on some state level suicide prevention efforts that are going on both in the Nevada Office of Suicide Prevention as well as other Nevada offices and bureaus. So just a little quick housekeeping. This webinar is being recorded. We've been able to get the recordings available to you on YouTube. I will put this link in the chat. Also, if Emma has any slides, I will include any of her slide decks and post them on the All Boards website, nvbh.org. Please keep your microphone on mute. It should be automatically muted with this format. But if for some reason you come off mute, I do reserve the right to mute you if you're not actively speaking. If you have not already done so, please enter your name, title, and agency in the chat. And let's go ahead and hold questions for the end of the presentation. That being said, there is a Q&A specific box. If it should be on your toolbar, it'll either say Q&A there, or if you don't see it, you can probably go to the three dots that say more. And once you click on that, Q&A will be one of the options. So if you have a question as we go, you can go ahead and pop your question in there. Or at the end, we can go ahead and answer your question live if you're more comfortable with that by using the raise hand option. This webinar and all the others in this series are brought to you as a collaborative project from the Nevada Public Health Association's Advocacy and Policy Committee, the Behavioral Health Association of Nevada, and all 5 regional behavioral health policy boards. So what is the purpose of this webinar series? So we wanted to provide snapshots of what's currently going on in our behavioral health systems across Nevada, in preparation for the legislative session. I realize this is week 2 of the session, so it's no longer pre-session, but so far bills are just starting to get scheduled. So we're going to wrap up this webinar series this week. We've tried to make our best efforts to include speakers who are subject matter experts, who also don't stand to benefit either politically or financially by speaking to us. We do have 3 more webinars this week. On Wednesday at noon, we have Nevada's Crisis Response System from Rachel Isherwood, who is overseeing that project at the Division of Public and Behavioral Health. And then from the Attorney General's office, we'll have Dr. Terry Kern speaking to us on Thursday at noon, giving an overview of the Surge 2024 annual report. And last but not least, we will have Ann Jensen, who is the agency manager at the Division of Healthcare Finance and Policy, giving us an overview of the Nevada and DOG agreement for the Children's Behavioral Health System transformation. A little bit about the policy boards. As they stand, we have 5 regions. There is some legislation that may change that. We aren't quite certain where that's going to fall in the long run. The boards consist of 7 to 13 volunteer members. Each seat on these boards is representing a specific professional part of behavioral health systems. So we have law enforcement, criminal justice system, EMS, psychiatry and psychology, drug and alcohol counselors, et cetera, et cetera. The purpose of these boards is to advise state level agencies, and each board gets 1 BDR each legislative session. Please note that those who are members on the regional behavioral health policy boards are not paid to be there. You can see the general outline of the boards here. So Washoe is just Washoe County. The Northern Behavioral Health Region includes Carson, Churchill, Douglas, Lyon, and Story. I serve the Rural Board and Rural Region, which is Elko, Eureka, Humboldt, Lander, Pershing, and White Pine. The Southern Region there in green is Esmeralda, Lincoln, Mineral, and the majority of Nye County. And then Clark, which is there in orange at the bottom, includes Clark County and that southern tip of Nye County to include Pahrump. Your 4 current behavioral health coordinators are here. The Clark Regional Behavioral Health position is currently vacant. The purpose of our coordinators is to serve the boards. We act on their behalf. We try to keep projects moving that they prioritize. So that is where we come to play. So without further ado, I'm going to stop my sharing and hand it over to Miss Emma. Thank you, Emma.
Thank you. Can you hear me, Valerie? Is that working?
Yes.
Okay, thank you. Sometimes Mondays technology doesn't always want to work, but thank you so much for having me. I'm going to go ahead and share my screen. All right, that seems to be working.
Yes.
Perfect. Awesome. All right. Well, welcome. Thanks, everyone. And thanks, Valerie, for setting that up. Yeah, happy to answer any questions after the presentation. I try to keep my content pretty limited on the slides just because there's a lot of things to talk about. So if there are questions, please don't hesitate to ask. If you aren't familiar with what I do in the state, which I see a few of you on the call, I know very well. So some of this might be a reminder for you on what we're doing in the state. But my name's Emma White, and I'm the Youth Suicide Prevention Coordinator with the Nevada Office of Suicide Prevention, which is under the Division of Public and Behavioral Health. My role is in partnership with the Nevada Department of Education under the Office for Safe and Respectful Learning Environments. So that's a lot of words. Basically, I am in charge of youth suicide prevention throughout the state, in partnership with many of you, with nonprofits and school districts and other agencies. I also manage the Project Aware and the Garrett Lee Smith grant. Both are SAMHSA grants, and I will go over those in a little bit. So I would love to give you a high-level overview of what we're doing for youth suicide prevention in Nevada, and many of you might be a part of some of those things. Just a little bit about the Division of Public and Behavioral Health if you're not aware of it. Here's our mission, vision, and purpose, ultimately to make everyone's life healthier, happier, longer, and safer in the state. Now, a little bit of the Office of Suicide Prevention. We've been around actually since 2003, but many people that we exist, I don't know why that is. Maybe because we're a small team, but many of you probably do just because of your roles and what you do. But our mission is to reduce the rates of suicide and suicidal acts throughout Nevada. Again, collaborative efforts. We work with anybody and everybody throughout the state with this goal based on the National Strategy for Suicide Prevention. We have two offices, one located in Reno, which is where I'm at, and one in Vegas. We have 6 people on our team. 2 of us are contracted, myself and my Project Aware colleague Alex, and yeah, small but mighty team for the whole state. And we really are in charge of prevention, intervention, and postvention. But what we like to do as an office is we really like to empower organizations. We like to come alongside them and help them in their suicide prevention efforts because we certainly can't do it all and we don't want to do it all. We want it to be a collaborative effort. Suicide prevention really is everyone's business. So really lucky to work with such amazing people. So I want to talk a little bit about data. The word current here is relative because I know that we're in 2025 and you'll see that the data that we share is a little bit behind. For many of you, this is probably a reminder. You've probably seen this before. If you haven't, it's just really important to see where we're at as a state. Of course, we've got national data as well, which I can touch on after this, but just important to see where we're at. Now, it says 2022. I know we're in 2025, so we're about 3 years behind in what we can share. The state of Nevada does have we do collect our suicide data, so we know as an office where our suicide losses are at, even right now in 2025, but we can't give that out to the public until the CDC confirms it. So we're hoping the CDC confirms our data pretty soon. The reason that we wait for the CDC to confirm it is because on average, about 10% of suicide losses happen outside of one's home state. So we know that Nevada is a very transient state. We've got lots of people coming and going. We don't count people, we don't count suicide losses for people who come to visit. So about 10% of those losses nationally happen outside of one state. But if we're looking at 2022 numbers, which is the most current we can give, Nevada ranked 7th in the nation for suicide. This is age adjusted, or, I'm sorry, this is per capita. You can also look at suicide rates age adjusted. If we were to look at the age adjusted rates for 2022, we'd be sitting at 11th in the nation. So we're still really high. You'll see that we had 698 losses in 2022 to suicide. This was pretty consistent with our 2021 numbers. So, you know, that 7th highest rate doesn't look great, especially since we have 50 states, but we have made progress as a state. And really one of the things we look at is our data from a long time ago. And when we look at suicide rates from 1939 to 1999, Nevada ranked first in the nation. So for 6 decades, we were first. So we're happy that we're not first in the nation, but we know that we have a long way to go. And that's why I'm so thankful that you're here today. Suicide is the second leading cause of death for ages 8 to 44 in Nevada. So it's not just our youth, but it is getting up into our adults and middle-aged adults. I know it's really, really hard to see that 8 on there. And unfortunately, we have to use it because the youngest person we've lost to suicide in Nevada was 8 years old. Nationally, it's a little bit younger, which is just heartbreaking. Nationally, the youngest we've lost to suicide was 5. So these are really important conversations that we have to have in our schools, in our families, our communities, talking about emotional health, talking about our mental health. It impacts everybody. All of us have it. So we also have a high suicide rate amongst our veterans in Nevada. Probably not a surprise for those of us who've been around for a while because Nevada does have a large military population, but nationally we have high suicide rates as well. So it's not just in Nevada. We can't blame Nevada for everything. Nationally, we lose about 17 veterans a day to suicide, so we have to be doing better. And I know the focus on this on this presentation is for youth, but the thing is, many of our youth have family members in the military. They have parents that are in the military, and those losses impact them as well. We also have a high suicide rate amongst our older Americans. So 65 and older population, we're 6th in the nation. We are moving in the right direction though with this number because for the first time ever in state history, in 2022, Nevada moved out of the top 5 for our older Americans suicide rate. So we're hoping to keep moving in the opposite direction of first. Now, as we look at our leading causes of death in Nevada, nationally, if we looked at all ages, leading causes of death include cardiovascular disease, heart disease, other things like that. But in Nevada, what's interesting is we have an equal amount of suicide deaths per and homicide and vehicle accidents combined. So what that is telling us is that we actually are having more homicides and we're having more motor vehicle accidents. So I just think it's an interesting point, especially when we talk about suicide, because we are seeing a little bit more uptick of suicide and homicide going together. I'll talk a little bit later about what we're doing in schools. And when I'm screening students in schools, I'm asking them about suicide, but I'm also asking them about homicide. And that is really, really important. Now, as we look at our suicide deaths, our math tells us we lose one person in the state of Nevada every 13 to 14 hours. So 1 to 2 people we're losing every single day. Nationally, we lose one person to suicide every 11 minutes. So it is much larger. It's obviously a larger population as we look at the whole country, but it is a problem in the country. If we were to look at a universal scale, we lose one person to suicide every 42 seconds in the world. So suicide is not just an issue here in the United States, but it's also throughout the world. So those are just some suicide statistics to look at in Nevada. I will, maybe Valerie can put it in the chat or I can find it and put it in the chat. The state does have a data dashboard that is a little bit more updated. It's 2023 numbers, and it shows suicide hospitalizations for suicide attempts. It also shows suicide deaths and other death data. So if you're not aware of that dashboard, it's really helpful. Now, it doesn't tell the full story in Nevada because it really is on the hospital reporting side, but it does help give a little bit better picture, a little bit more updated than 2022. All right, let me move forward. So one thing that I'm really passionate about is also supporting our suicide attempt survivors and talking about postvention. Oh, thanks, Valerie. I see you put it in the chat. Of course, a suicide loss is devastating, and I'll talk about postvention in a little bit. Really, we want to also think about those suicide attempt numbers because it's staggering. Our suicide loss numbers are awful. Our suicide attempt numbers, it's just so sad to see how many people are attempting suicide. So if we look at our United States data, 2022, there was a reported 1.6 million suicide attempts. And that's a high number already. But then we look at that keyword reported, and it's really kind of comes to fruition that we would have a lot more numbers if we had an accurate reporting system for people who survived a suicide attempt who didn't tell anybody or who didn't go to a hospital or emergency room or didn't tell a family member. We estimate that this 1.6 million would be so much higher if we had a way of collecting those numbers, but we can't just pull them out of thin air. We can't speculate. I will tell you though, I have worked in schools, I have worked in communities all across the state, and I have had conversations with students as young as 11 who had a suicide attempt 2 or 3 years ago, and they survived, and nobody knew. They didn't tell anybody. I was the first person to ask. So again, really hard number to see, but we estimate that it would be larger if we had a way to find out those unreported numbers. Now, the Trevor Project, which is the leading LGBTQ nonprofit for mental health, they estimate that one youth aged 13 to 24 in the United States who identifies as LGBTQ attempts suicide every 45 seconds. If you look at that third line there, it's really sobering. One suicide attempt every 26 seconds for adults, and one every 50 seconds for our overall youth population. So again, suicide survivors, they are among us, they are with us, they work with us. I'm one of them. So I'm really passionate about this and keeping this in mind because yes, we want to help families after a suicide death, but we also have to help students and families who have survived a suicide attempt. Some interesting data research actually comes out of the Golden Gate Bridge in Stanford, and they found that 90% of attempt survivors who got proper resources and support never went on to attempt suicide again. So that's a really great number, shows the power of mental health support. But 10% of those survivors who did not get accurate support or the right help were statistically at higher risk to attempt suicide again. So again, shows us how important it is to support our survivors. And lastly, this will lead a little bit more into our postvention, but research tells us on average 125 to 140 people are directly impacted by a suicide death. Those people become 3 times more likely to develop thoughts of suicide themselves. You know, I will tell you that I think that this number is really low. And that's just because working in communities, if I have a student who dies by suicide at school, everybody at that school is impacted. I mean, there's layers of impact, but everybody, so it's so much larger than 125. But really important to think about this, 3 times more likely to develop thoughts of suicide themselves. It doesn't mean that suicide is contagious. And we're really moving away from that. That stigma, I think a lot of work has been done to get people to recognize that that's, you know, suicide's not contagious. But what we talk about here is that there is a suicide contagion factor. Words are very similar, contagious and contagion. What that tells us is someone who is already thinking about suicide, if they are impacted by a loss or see a sensationalized, you know, report of suicide, that could impact them at a higher level than someone who wasn't having thoughts of suicide. And so that's where we see that contagion factor, is that they might be more likely to attempt suicide because they were already thinking about it and then they were exposed to it. So really important to differentiate. It's not contagious, but there is that contagion factor. And the media plays a really big role in that. And we've been doing a lot of work with the media and how they report on suicide over the last few years. All right, I'm going to move forward. So just some points here on what we're doing in Nevada. This is not all comprehensive. There are so many things that are going on in the state for youth suicide prevention, but this is really what we're focusing on as a state agency, again, in partnership with the Department of Education. So many of you probably either run these programs at your schools or you know of these programs, but I want to talk about them just in case you aren't aware of them. It can be really helpful in knowing what's already going on. So the first one here is the Signs of Suicide program. This is a program that comes out of a California company called MindWise. We commonly refer to it as SOS. And I think it is truly life-changing. I've seen the impacts of it. In Washoe County, Signs of Suicide is required for 7th graders. So the Children's Cabinet partners with Washoe County School District. They train the students in Signs of Suicide. It's about a 45-minute presentation where the students learn the ACT model, which stands for acknowledge signs of suicide in a friend, care about them, and tell a trusted adult. So essentially, we're giving students the tools to recognize when their friend is in distress and then reach out for help. Now in Washoe County, they do a clinical screening for suicide on every 7th grader that participates in the program. It does have to be, parents are involved. So parents sign off yes or no on this. It isn't a mandatory thing, but we really try to encourage families to let their students participate in it because it can really help kind of find students that are maybe struggling, that are falling through the cracks, or people wouldn't recognize they're having thoughts of suicide. The other important part of this is that it gives them language. So if they're not thinking about suicide now, maybe in the future, if it does come up for them or for a friend, they know what to do. They've got middle school programs and high school programs. So Washoe County, like I said, does it for seventh graders. Clark County also does it for their students. In our rural communities, lots of communities doing SOS. Carson City does it. Lovelock does it. Fernley, Battle Mountain, Winnemucca as well. So hopefully, I would love every school district in the state to do it. What it looks like a little bit more outside of larger cities, because we know that mental health professionals are really hard to come by really anywhere in the state, is that what we typically do is we will, not every district, but a lot of our rural districts will do the Signs of Suicide program training. And then we hand out this little white slip of paper, and the students can self-identify if they would like to talk to somebody, either for themselves or for someone else. From there, we have to pull them out of class that day. We debrief with them about what's going on. Sometimes it's about suicide, sometimes it's not. And from there, we assess what level of support they need. So I will tell you, on a data, looking at data, typically about 30% of middle schoolers will ask to talk to somebody. And this is just statewide. About 30% of middle schoolers will ask to talk to someone. Candidly, sometimes it's because they want to get out of class and they pretend like they don't know what they just took, or, oh, I didn't take Signs of Suicide training 30 minutes ago. But most of the time, something's going on. I will tell you that our school counselors and mental health professionals, social workers in schools are doing the best that they absolutely can. And most of the students that identify that they want to talk to someone are already on the radar. It's very rare that a student is not on the radar for this. So just kudos to people working in our schools, because they really are saving lives every day. And so they self-identify, and then we pull them out of class, we talk to them. If it is about suicide, typically about 15% of them need a little bit higher clinical screening. And then from there, even less, about maybe 5%, 2.5% to 5% need a higher crisis intervention. So it's a really fantastic program. It's $500 a year for a school for a registration. So it's not terribly expensive. And so if you know a school that could benefit from it, please reach out to me. You can always look at trying to find funding as well. I can't promise funding, but we definitely try to help as much as we can. Or if you have a school district that would like to implement it and you want to know how, please reach out to me and I'll let you know, help you come alongside with that. So that's one thing happening statewide. It is starting to move into high schools in Washoe County, Clark County as well. So we're starting to see that expansion of that program. The second one is Hope Squads. I know many schools have Hope Squads in the state. I believe we have 88 schools statewide that are participating in Hope Squad. It is a peer-to-peer group. Kind of think about like when you were in school and you had like a leadership team and they planned prom and events and stuff. It's kind of like that, but their peers nominate them, and the whole goal and structure of Hope Squad is to pull kids from different kind of groups of people. So you're not just having like all the popular kids or all the football kids in Hope Squad. It really pulls kids from all walks of life, and they get trained in suicide prevention and other things as well, like anti-bullying strategies, mental health. And I've seen Hope Squads around the state plan mental health fairs, awareness weeks. I've seen Hope Squads help out with signs of suicide. It's really, really awesome. It's a great program. Typically, you've got 2 to 3 school leaders that are helping students get involved in that. That one's a little bit more expensive. I believe it starts out at $2,500 a year, and then it can go up from there depending on how many lessons you choose. The standard is 9 lessons per school year. So it's not all focused on suicide prevention. There's some restorative justice, restorative practices in there, but it's a really great program. It started out in Utah, and it's been moving across the country. So Hope Squads are in Nevada. Hopefully we can, hopefully, that was a funny pun, play on words for me. We can implement it in other schools moving forward. Now, the third one is an initiative called Project Stay. 3 to 4 years ago in Northern Nevada, in Washoe County, we lost a teenager to suicide who was very active in sports, playing football and baseball, basketball. And just, every suicide loss is heartbreaking. This one, it was really interesting because the parents, had kind of done everything right. Um, they found out, though, that after the fact, that a lot of the students, like classmates and kids that he was playing sports with and coaches, had recognized some signs of suicide, but they hadn't had any training, so they didn't really know what to do about it. And they don't blame anybody, but it was an interesting point that they learned. And so then they did a little bit deeper dive and found that the state of Nevada does not require sports coaches to get trained in youth mental health or suicide prevention. The NIAA also does not require it, so it is a huge gap because we know that our coaches are with students all the time, and a lot of times coaches are the kids' trusted adults. So they started this initiative. They partnered with Renown Health and offered money stipends to coaches and sports teams that got 95% of their coaches and staff trained in suicide prevention. So that was a few years ago. They started kind of small, and we partnered with them. The Office of Suicide Prevention partnered with the initiative. We're kind of owning it now because the family is still very much grieving and kind of dealing with that loss. So they said, hey, if you guys want to expand this program, please do it. So we've started to expand Project Stay. We are going to expand it into our rural communities very soon through various grant opportunities. What it does, like I said, is it pays stipends to coaches. Well, really, initially it started out with sports, but now it's more just youth organizations in general. So it could be something like Girl Scouts or a leadership group or whatever, any type of after school program or organization that students are participating in. That's our goal, is we want to get 95% of those leaders of those programs trained. So Renown is really funding the Washoe County side of things, and we're looking at extending it and expanding it statewide through other funding opportunities. So if you are interested in partnering on that, let me know. Reach out to me. We do want to try to find a sponsor in Vegas. And then through other grant funding, we're going to provide it in Carson, Churchill County, Elko, and around there. So that's a little bit about Project Stay. I know you guys will probably have questions because I'm giving you a lot of content. So afterwards, please feel free. Next is Project Aware. I manage this grant through the Office of Suicide Prevention. We as an office are a sub-grantee from the Department of Education. So Project Aware is a 5-year SAMHSA grant. It stands for Advancing Wellness and Resilience Education in Schools. Our goal is to train 90% of staff, 25% of students, and 10% of families in suicide prevention initiatives. And then through the State Department, through the Education Department, there's other things like implementing MTSS strategies, tier-leveled support, different things. This grant currently is only focused on Washoe County, Southern Public Charter School Authority, and Carson City School District. It is finishing up in September of this year, so it'll be done then. The only people that can apply for Project Aware is a state entity, school districts, or higher education. The city of Winnemucca actually has a Project Aware grant that they applied for as a school district, and they got it. So they're running their own separate Aware grant. But we've only had, as a state, we've only had 2. We're in our second cycle, like I said, finishing up in September. The first cycle was focused in Lovelock, Elko, and another rural city, but I cannot remember right now. But it's done some really great things to help really advance, like I said, wellness and resilience education, including suicide prevention. The next grant that I manage is the Garrett Lee Smith grant, also a 5-year SAMHSA grant. We were awarded this in October of 2024 after 12 years. We hadn't had a Garrett Lee Smith grant in 12 years, so we're very excited to have this. This is a 5-year grant focused on Elko County, Churchill County, and Carson City School District. The entire grant is youth suicide prevention, 10 to 24 years old. So that's the whole focus. We don't do really anything outside of it. It's really promoting training, family support groups, behavioral health interventions, trying to provide clinical help for students having thoughts of suicide so they don't have to go to emergency rooms, because we know that that's a challenge right now. And so if you're ever interested in learning more about what we're doing with the GLS grant, please reach out to me, let me know, because it's a pretty brief presentation and there's a lot going on in that. And then I'm going to talk about postvention and policy. So real quickly, like I said, GLS is what we call it, the SAMHSA grant. You'll see really promoting intervention strategies. We also work with juvenile justice systems, other substance use and mental health programs, foster care systems, and other youth serving organizations. Now, from the Department of Education side of things, I want to talk about suicide postvention. I'll have to put the document in the chat. It is on the Nevada Department of Education website under the OSERLI page. So it's right on the front page. I don't know, Val, if maybe you find it, you can put it on here, but it's the Nevada Postvention Toolkit. We started creating it in 2023. We finished it up in 2024. There are national strategies and international strategies for postvention. In 2016, the state actually created a postvention toolkit, and it wasn't very widely adopted or respected, only because it wasn't localized. It was all information that was brought from national leaders, which was great, but Nevada is a very specific state. And in order for us to get people on board with doing this work, we need to bring it down to the local level. So we started building that in 2023. It is a 45-page document on postvention. What do you do after a suicide loss, whether it's a student or staff member, whether it happens on campus or outside of campus? For a long time, our schools didn't think that postvention was really their responsibility. And then what we found was communities look towards schools for information and support in so many different ways. And postvention is an organized response. If we do postvention right, it really can help prevent future suicides. So like I said, it is located on the OSERLI website. There's so much information. It's such a comprehensive toolkit, but it's really fantastic. I know I'm a little biased because I helped create it, but it's helped our schools and even communities have the same conversation, the same language after a suicide loss. Because ultimately what happens is if we don't have an organized response, if we don't have things set in place before a suicide loss, if it happens, a lot of times we're scrambling. We're in crisis mode, we're in emergency mode, and we're trying to figure out all the things, and that can be really stressful. So we want people to know what to do before or if it ever happens. So again, suicide postvention, I'll find it, put it in the chat. Now, a little bit about policy, which also falls into a lot of the work that we're doing as a state. Nevada Revised Statutes 388, suicide is mentioned 72 times in this statute, including things like suicide prevention education, both for students and staff. That's where kind of signs of suicide comes in, staff getting trained in trainings like Safe Talk or Assist, mental health first aid, ongoing trainings. There's also the postvention policy in the emergency operations plan. So if you were to go into NRS 388.243 through 253, you would see that NDE requires postvention policy and an emergency operations plan. They haven't widely, how do I say this? It's been in policy. Does that mean it always happens? No. So we've been working really hard to help our schools get that policy in, because by next school year, August, they will require it to be in an EOP when it gets submitted for approval. So postvention policy, but there's also prevention, intervention, and like I said, postvention policy in that statute. If you're ever interested or needing model policy on this, needing to draft language, include policy in your school or even work, please reach out to me. I'm happy to help you. Policy can be a little bit challenging sometimes to draft. We don't know what to include or what not to. So NDE actually has a draft model policy that will help you build it, and some other helpful things as well. So on the policy side, that's what we're seeing. And I'm not going to go into crisis response because, as Valerie said, it's tomorrow. My department actually reports to Rachel Isherwood with the 988 crisis unit. So tomorrow you'll hear a lot about what they're doing, and some policy will be involved in that as well. All right, just a quick reminder, some resources, of course, 988 always available. There's options there, mobile crisis, Just because I know this is always, tough to talk about, or it's just hard work. Anybody that's doing this work, one, thank you so much for being here and doing this work, and two, know that you're not alone in feeling stressed out or overwhelmed or burnt out because it's a lot of work. So just keep in mind those resources to help for yourself or someone else. All right, that's it for me. I know it's a lot of content, so I'd love to open it up to questions if there are any, and I'll do my best at answering them.
Again, if you have any questions, please feel free to either use the raise hand button at on your toolbar if you would like to ask your your question live, or you can use the Q&A if you are not so comfortable. Cool thing about the Q&A is you can also do it anonymously if you are very protective of asking your questions. So, Emma, I believe I added the postvention toolkit to the chat. I at least I added something that appeared to be it, I should say. So hopefully that's the correct document.
Yeah, let me look.
Any
Let me see.
any questions for Emma while we're checking on that? And then Emma, what website did you say that this was posted on?
The postvention toolkit.
Yeah.
It is on there's so many acronyms in this work. I'll put it in the chat. It's on the Office for Safe and Respectful Learning Environments. It's under NDE. So just put it in the chat there. Hopefully you can see it. And it's
Yes.
on that main page.
Awesome. Thank you. All right. Last call for questions. Okay, Emma, if somebody has any questions for you later on, where can they contact you?
Oh, yes. Let me put my email in the chat. If you're interested in learning about any of the programs that I mentioned, just want to, talk about what's going on in Nevada, please let me know. I'm here, happy to help. Even if you are just feeling stressed out, I'm also here. So please feel free.
All right. Well, thank you so much. Thank you, everyone who joined us today. We greatly appreciate it. I will be getting this recording up as soon as I can, hopefully, maybe even today. And I hope you all have a lovely week. Remember, we do have the update on the crisis response system on Wednesday at lunch. That would be the 12th. The Surge work group annual report on Thursday at lunch. And then also the um, update on the Children's Behavioral Health Working Group and Transformation Project related to Nevada's agreement with the Department of Justice. That will be on Friday at lunch. So hope to see you all there. Thank you again and have a great day.
Thank you. Bye.